Solution-Focused Brief Therapy by Erlinda Addison. Solution-Focused Brief Therapy was developed in the late 1970s by Steve DeShazer and Insoo Kim Berg. This is an evidence-based therapeutic approach with the main focus of constructing present or future solutions rather than dwelling on problems of the past. Most other modalities focus on the problem rather than what needs to happen. This treatment with this modality usually lasts 6 sessions or less, but determining on the client's needs, it can actually go even longer. Main principles of SFBT. Small increments of change lead to large increments of change. This means that the baby steps that the client takes at the beginning or during the process of treatment can lead to big changes and attaining the goal. So it's important that we, as therapists, are patient with the client at this time and also be encouraging. Client solutions are not necessarily related to any identified problem. The problem doesn't need to be focused on in order to make progress. Solution-based rather than problem-solving. At this point, we focus on what needs to be changed. We don't rely on the problem or put much energy of focusing on the problem. Oftentimes when clients come into therapy, they want to discuss the problem, but with solution-focused therapy, we don't put much emphasis on the problem and we focus on the solutions. Exceptions can be utilized. Recognizing what has already worked and continuing to do it. Sometimes with clients, they often overlook their strengths and they just need help rediscovering and identifying that strength. Do something different if it's not working. Moving out of a problematic cycle by responding differently. You don't want to continue doing the same thing if you're still receiving the same results. In order to receive different results, you would have to respond differently. Don't fix it if it's not broken. That means basically don't reinvent the wheel if it's already working. Continue doing what's working. Use solution-focused language, positive language. Reframe for the client so that their perspective can become more positive and optimistic. The future is negotiable and created, which means it's attainable and changeable. Miracle question. You went to sleep last night and woke up this morning. A miracle has happened and your problem is gone. This is the classic question in solution-focused brief therapy. This question allows you to see how the client is able to reach their goals from their perspective. This question can go something like this. How would you know the problem is gone? What differences did you notice? What did others notice about you? What was better and how? How is it better than before? Exception questions. When were the times you didn't feel this way? Exception question is basically when the client did not have the problem. This helps the client shift to positive thoughts of when they can identify their own strengths that they already have, which again, they're often overlooked and they just need help identifying them. So some of the questions that would be accepting questions would be, when was the time you felt in control? Is there a time you found a way to overcome the problem? What do you need so that will happen again? What could you already do differently right now? What do you need so that this will happen more often in the future? Scaling question. Scaling questions can aid a client in identifying the ways in which they need to change. The questions do not always have to be in numerical form, but this method, it often can enable clients to feel more in control and a sense of power. Scaling question. On a scale of 1 through 10, with 1 being lowest and 10 being the highest, how much confidence do you have that you can keep going? Other questions include, what would you need, or what would need to happen so that you could move up in the scale? At what number do you need to move up to be content? What is the highest number at which you've ever been? What will be different when you move up 1 point? We don't always have to use a numerical scale when utilizing scaling questions, but we can also allow the client to use visuals. Positivity and hope. Positive expectancy, meaning hope. Belief that change can happen. Energize and sustain. Growth and expansion. Projection of hope from the therapist. Positivity and hope. The discussion of future possibilities elicits optimism and hope with our clients. So it's important or imperative as a therapist that we use an optimistic tone when asking questions in session, because our energy can be transferred to our client. As a result, the client feels that things can change and are able to change. The client becomes hopeful and looks forward to that change. In order to grow and expand, we need hope, as it brings a sense of confidence and energizes us. It not only brings confidence to our client, but it can bring confidence to you as a therapist. Diversity and culture. Therapist role. The therapist takes a non-directive role. What this means is that the client is the expert of their own lives. We sit back and allow the client to explain their experiences. Warm and empathetic. Warm and empathetic. We're empathetic and we show concern for our client when they're sharing their story with us. Lead from one step behind. We allow the client to tell their story without so much direction. We guide from the from see, open-minded and flexible, naturally positive and supportive. We use positive language in our sessions to help the client become more hopeful. Avoid power dynamics. We do not take advantage of the client's situation, of the client's story, or the client's vulnerability. Adapts to client's frame of reference and culture. We allow the client to explain from their point of view. We don't assume that each client is different. We know that every individual has a different experience and everything affects each person differently. Matches client's developmental level. We speak in such a way that the client understands what we are talking about. We can consider the client's educational level and the jargon that we're using in session so that the client understands how we communicate. Does not assume, assess to resources and privilege. Pros and cons of SFBT. Some pros include that this modality is diverse because it's client-centered. What it means is the client is responsible for the decisions that influence or impact their life. It also can be used in many different settings. Some settings include education, hospital, business settings. It can be used with groups or even individuals. This modality requires a collaborative approach, which means the client and therapist work together to make decisions as though this is a partnership. Cons of this modality would be limited scope because it doesn't allow for past attachments. Therapists may not be allowed to empathize with the client due to this being a quick, goal-oriented nature. It may not work well with those with severe mental health conditions or even addictions. It may not be beneficial for the client who's used to being instructed. Minimal exploration of negative emotion. This modality is goal-driven and does not allow for in-depth analysis of the client.